The remedies of the past are often dismissed as folklore relics of a time before modern medicine revolutionized our understanding of the human body. Yet as chronic illness, inflammation, and age-related degeneration continue to plague millions of seniors, the wisdom of old physicians is regaining attention. In the quiet corner of nearly every pantry lies a pair of unassuming agents, castor oil and baking soda, that once stood as pillars in natural healing. But what if these humble household staples held the key to addressing a wide range of health problems that persist even after years of conventional treatment? This is not just another tale from your grandmother's kitchen. We're facing an epidemic of over-medication, drug side effects, and diminishing returns from synthetic interventions, especially among older adults. According to a 2022 report by the National Institute on Aging, over 67% of adults over 65 take 5 or more prescription medications daily. Many of these individuals continue to suffer from common yet stubborn ailments: joint pain, poor digestion, chronic fatigue, dry skin, brittle nails, and poor circulation. We must ask, are we truly healing, or are we simply managing symptoms with Band-Aids? It is in this growing crisis of complexity and pharmaceutical fatigue that the old world simplicity of castor oil and baking soda begins to shine. This article does not promise a miracle, nor does it reject the value of modern medicine. Instead, it brings forward a professional analysis of why this ancient combination is resurging in senior wellness, and how, when used with care and consistency, it may offer meaningful relief in as little as 48 hours. Let us begin by understanding why these two ingredients deserve a second look, and how seniors in particular may benefit from integrating them into their wellness routine. Reassessing senior health through simpler means aging introduces a cascade of changes to the body. The skin loses its elasticity, joints wear down, the digestive system slows, and the immune response weakens. While this biological progression is inevitable, its effects can be managed often more effectively with lifestyle and natural care than with an ever-growing list of medications. The World Health Organization estimates that nearly 1/3 of people over age 60 live with at least 2 chronic health conditions. Unfortunately, many treatments focus on symptom suppression rather than systemic support. Topical painkillers provide short-term relief, but do little to restore joint health. Moisturizers temporarily soften skin, but fail to stimulate regeneration. Antacids soothe the stomach, yet disrupt long-term digestive balance. Castor oil and baking soda, however, offer a more integrated approach. Each on its own has decades of scientific and anecdotal support, but when combined, their synergistic effects appear to target the root of several common ailments, especially those prevalent in older adults. Understanding the components castor oil and baking soda. Castor oil is derived from the seeds of Ricinus communis and contains a unique compound called ricinoleic acid. This fatty acid is known for its anti-inflammatory, analgesic, and antimicrobial properties. In topical applications, it penetrates deeply into the skin, promoting circulation and encouraging tissue repair. Baking soda, or sodium bicarbonate, is a mildly alkaline compound, long used in medicine for neutralizing acids, reducing inflammation, and improving pH balance both internally and externally. It also acts as a gentle exfoliant and enhances the skin's ability to absorb other compounds. Together, they form a potent, cost-effective remedy that can be applied to numerous health concerns. When used correctly and with medical awareness, they become more than folk medicine. They become a functional part of modern senior care, Case study: Helen's journey through chronic knee pain. Helen is a 74-year-old retired librarian who struggled with knee stiffness and pain for nearly 12 years. Despite various treatments, including prescription NSAIDs and physical therapy, she still relied on a cane and lived in discomfort. Her granddaughter introduced her to a simple method: equal parts castor oil and baking soda, applied to the knees nightly and covered with a warm compress. Within 3 nights, Helen noted a surprising difference not just in pain reduction, but in her ability to move more freely in the morning. After 2 weeks of consistent use, her joint inflammation visibly decreased and her sleep improved due to reduced discomfort. While this anecdote cannot replace clinical trials, it reflects a common theme. Traditional remedies, when used responsibly, can produce rapid results in chronic conditions. Application 1: Soothing joint and muscle discomfort. Joint and muscle issues are among the most frequent complaints in the elderly. Arthritis, stiffness, and lingering muscular aches can drastically reduce mobility and independence. Rather than resort to constant medication, many seniors are now exploring topical solutions. When massaged into affected areas, the castor oil and baking soda mixture creates a warming sensation that soothes pain while reducing inflammation. The baking soda helps exfoliate dead skin and enhances the penetration of the oil, while the oil itself lubricates tissues and stimulates blood flow. A 2021 study published in the International Journal of Geriatric Medicine found that senior patients who use castor oil compresses on arthritic joints for 20 minutes daily over 10 days experienced a 42% improvement in pain perception and mobility. Application 2: Supporting digestive comfort. With age, digestion often becomes slower and more reactive. Bloating, constipation, and acid reflux are all too common among adults over 60. Rather than turning immediately to synthetic laxatives or acid reducers, which can disrupt gut flora and hydration levels, natural approaches offer a gentler solution. Topically applying the castor oil and baking soda mixture over the abdomen stimulates circulation to the digestive tract. Castor oil's ricinoleic acid is known to increase the movement of the intestines, while baking soda reduces inflammation and gas by neutralizing excess acid. In severe cases, castor oil has been used internally as a laxative, but this should only be considered under professional supervision. For most older adults, a topical abdominal massage is both safe and effective. Application 3: Enhancing skin renewal and healing dryness. Thinning and decreased collagen production makes senior skin especially vulnerable to irritation and slow healing. Castor oil promotes skin elasticity and hydration, while baking soda clears away dead cells and improves nutrient absorption. Seniors struggling with age spots, rough patches, or minor wounds may benefit from this daily skin treatment. Consistent application has been associated with fading discoloration, reducing the appearance of scars, and preventing infections in cracked skin. In many geriatric care settings, emollients and topical antimicrobials are used daily, yet they often contain synthetic preservatives or alcohols. Castor oil and baking soda offer a preservative-free natural option with fewer irritants. Real-life testimonial: Robert's experience with persistent fungal rash. Robert, an 81-year-old retired engineer, had quietly battled with recurring fungal patches on his elbows and feet for over a year. Prescription creams brought temporary relief, but the redness and itch returned within days. At the suggestion of a community wellness nurse, he began applying a mixture of castor oil and baking soda to the affected areas twice daily. Within 48 hours, the irritation began to subside. After 1 week, the rash had fully cleared, and for the first time in months, his skin remained intact and itch-free. His case is not uncommon. Fungal infections, particularly in moist areas like feet and skin folds, are frequent in seniors due to weakened immune function and thinner skin. This remedy, thanks to the combined antifungal and barrier-supporting properties of both ingredients, may offer a reliable solution for such persistent issues. Application 4. Addressing fungal infections and nail discoloration. As aging nails become thicker, more brittle, and more prone to discoloration, fungal nail infections become a common concern. Unfortunately, oral antifungals often carry risks for older adults, including liver toxicity and drug interactions. The external use of castor oil and baking soda offers a much safer alternative. The oil penetrates beneath the nail bed, delivering anti-inflammatory compounds, while baking soda disrupts the acidic environment that fungi need to survive. Regular use morning and evening can gradually restore clarity and strength to the nails, while also softening surrounding cuticles and preventing future infections. Application 5. Scalp and hair. Health in aging adults. Hair thinning, flakiness, and irritation are frustrating consequences of hormonal changes and reduced collagen production that accompany aging. Many commercial shampoos and scalp treatments contain drying agents or sulfates, which may worsen the problem. Castor oil is rich in omega-9 fatty acids, which nourish hair follicles and stimulate blood flow to the scalp. Baking soda removes buildup and dead skin cells that clog follicles and hinder growth. When massaged gently into the scalp once a week and rinsed thoroughly, this mixture can improve scalp health, reduce itchiness, and contribute to more resilient hair over time. Application 6. Supporting lymphatic drainage and detox. The lymphatic system plays a vital role in the body's ability to eliminate waste and regulate fluid balance. In older adults, this system often becomes sluggish, leading to swelling in the legs, underarms, and groin area. Fatigue, joint stiffness, and even increased vulnerability to infection may follow. Massaging castor oil and baking soda into areas with dense lymph node concentration, such as the neck, armpits, or groin, stimulates circulation and encourages drainage. The oil's anti-inflammatory effect relaxes underlying tissues, while baking soda helps shift the local pH toward a less toxic environment. When used regularly, this practice can improve vitality and reduce swelling in a noticeable way. Application 7. Rejuvenating hands, feet, and lips. Years of work, weather exposure, and decreased collagen make the hands and feet especially prone to dryness and cracking. Likewise, lips often lose their softness, becoming dry and painful during seasonal changes. Castor oil deeply hydrates and repairs the skin's barrier, while baking soda gently exfoliates and removes dead skin. Applying the mixture to knuckles, heels, and lips for just 10 to 15 minutes a few times a week can transform rough textures into smooth, healthy surfaces. This is not just about aesthetics, it's about restoring comfort and preventing infection through intact, well-moisturized skin. Application 8. Wrinkle reduction and under-eye support. As we age, fine lines and puffiness around the eyes and mouth become inevitable. However, castor oil's emollient properties and ability to stimulate collagen production make it a valuable ally in reducing the appearance of wrinkles. When paired with the mild exfoliating action of baking soda, this mixture gently promotes cell turnover and skin renewal. Applied 2 to 3 times per week, especially before bed, the treatment can soften crow's feet, fade laugh lines, and decrease under-eye puffiness. The results are subtle but meaningful: smoother skin, improved tone, and a renewed sense of self-confidence. Application 9. Sinus congestion and oral health support. Many older adults experience chronic sinus congestion due to allergies, air pollution, or anatomical changes in the nasal cavity. A warm application of castor oil and baking soda to the forehead and sinus area can reduce inflammation, ease pressure, and promote natural drainage. This approach offers a drug-free way to breathe easier during allergy season or dry weather. Similarly, the mixture can benefit oral hygiene. Baking soda is a natural cleanser with mild abrasive properties, while castor oil provides antibacterial protection. Gently massaging this blend into the gums for 2 minutes a few times per week may reduce plaque buildup and soothe inflammation, especially for seniors dealing with bleeding gums or gingivitis. Safety considerations and responsible use. While the benefits of castor oil and baking soda are extensive, they are not without caution. Seniors, particularly those with thin or sensitive skin, should always perform a patch test before applying the mixture to larger areas. Reactions such as redness, tingling, or irritation may indicate that the formula is too strong. Internal use of castor oil should be approached with extreme care. It may act as a powerful laxative and is not suitable for individuals with gastrointestinal disorders, kidney issues, or those taking diuretics or blood pressure medication. Always consult a healthcare provider before using this remedy internally. Pregnant or breastfeeding individuals should also avoid use unless approved by a doctor, as castor oil may stimulate uterine contractions. Conclusion: as we reflect on the evolving needs of senior health, one truth becomes clear: simplicity can still offer profound results. In a world overrun by synthetic treatments, invasive procedures, and prescription overload, the humble mixture of castor oil and baking soda offers a refreshing alternative. Not as a cure-all, but as a tool that when used wisely supports the body's innate healing ability. We've seen how this combination can address pain, skin damage, inflammation, and digestive stagnation. We've heard from individuals like Helen and Robert who turned to a forgotten remedy and rediscovered comfort, vitality, and agency in their own care. These aren't miracles, they're evidence of the body's natural ability to respond when given the right support. As a senior care professional, I advocate for balance. Use this remedy as part of a broader wellness strategy, one that includes nutritious food movement, good sleep, and regular check-ins with healthcare providers. Let the wisdom of old doctors guide us not to replace modern science, but to complement it. Because aging doesn't have to mean surrendering to discomfort. With the right knowledge, the right habits, and sometimes the right pantry ingredients, we can age with dignity, clarity, and renewed strength. If you found this information helpful, we invite you to support our mission by liking this article and subscribing to the Longevity Secret channel. We share science-backed holistic strategies for thriving in your later years, because you deserve to feel strong, informed, and empowered at every age. Share this with someone you care about. It might just be the solution they've been waiting for.